The WSPCF is a philanthropic African foundation which brings pediatric cardiac care to children from all across the continent. To date, we've assisted kids from over 24 countries across the continent.
The doctors from Zambia, Zimbabwe, Nigeria, Senegal would call and they would send us a report. The reports get assessed by our panel. They would then go through all the applications for the operations. They were graded A, B, and C.
So an A case is essentially a case that the doctors feel has a very good prognosis. The doctors know that generally the child will come in and they should be in and out of hospital within 2 to 5 days. And then B and C means that either the child has maybe one extra complication, maybe they have a pulmonary complication, so a slight complication with their lungs, or they have maybe 2 holes, or that their lesion is slightly more complicated than a simple correction. So that's a B. And then C cases are the cases, so what happens, of course, because we also get children that are from outside of South Africa. So we get a child who we think may be an A or B case, but then once they get assessed, you realize that it's a C case. And that can be very complicated because you never want to turn kids away. But also we have to deal with the fact that we are a donor-funded organization.
We contacted the Walter Sisulu Heart Foundation and we got in touch with Patsy. We had no hope. It was just once again going from doctor to doctor, cardiologist to cardiologist, and of course the expense of doing a heart procedure was just really out of our affordability.
Brian came to us in August of 2011. He had the correction done at Sunningham Hospital, like I said, by Dr. Greg Martin, and it was incredible. After his recovery, of course, just like all of our little kids, he had the most energy ever. He was running around all over the place, and Patsy has been in touch with, and we've been in touch with him ever since.
He's just the most pleasant child. And it is all because of the foundation that we are able to have a child who is a healthy child, and we are just so grateful to the foundation for the gift that they've given us, the gift of life that they've given Brian also.
The GAC has contributed to the foundation in such a tremendous way, but what I really appreciate is the level of engagement that we get from JAC as a sponsor. So they're not just saying, here you go, here's some money, help some children. They're saying, what can we do to assist you? What are you doing? They want to know about the beneficiaries. They want to know about the foundation and the project, and I think that's really what makes JAC stand out.